Hello, my name is Gwen Ellen O'Donnell. I'm the Deputy Director of the Food Security and Resilience Team at CARE USA. I am happy to hopefully be one of the first people to welcome you to CARE. And if you're not new to CARE and have joined today to learn about our SFP approach, welcome and thanks for joining. I'm really pleased to be sharing a bit about our approach in the next couple of minutes. So thank you so much. I'm going to stop my video so that I can focus on my slides and make sure that that goes smoothly as we get into the presentation. There we go. So the goal of CARE's school feeding program is to reduce hunger and boost food and nutrition security for children in order that they have the physical and mental capacity to improve literacy and overall educational outcomes to help them reach their full potential in life. And the way that we do this at CARE is primarily through two strategic objectives. And they are improving the nutrition and health status of school-age children, as well as improving their literacy skills. Now, this is a very simplified way to present CARE's approach, as obviously there are many subcomponents of each of these two objectives, but I'll be talking about them in the next couple of slides. So according to UNESCO, there's an estimated 260 million school-age children who are not enrolled in school, and this is due largely to hunger and or malnutrition. And a majority of these school-age kids are actually girls. The school feeding programs that CARE typically implements are in developing countries where education and food and water systems are very weak. Nevertheless, in providing school meals, in strengthening teacher capacity, through health, hygiene, and nutrition support, and improving the overall school learning environment, CARE can help to boost school enrollment and academic performance. And we have proven that in a number of our programs. CARE's approach strengthens community linkages and increases government as well as community member capacity to implement school feeding activities, which obviously involve food commodities. And these commodities are directly distributed in schools or provided to students as take-home rations. Now, I think we all know that nutrition is really important. Endemic malnutrition is often a key factor in the places where we work, and it costs lives, reduced educational attainment, and erodes nations of essential socioeconomic capital. It is also a key challenge in our school feeding programs. As you know, the first 1,000 days are a time of tremendous potential as well as enormous vulnerability. Nutritional deprivation in the womb, followed by macro and or micronutrient deficiencies in early childhood, leads to impaired neurodevelopment, impacting cognitive skills and the ability to absorb, retain, and learn information. Now, ideally in all of our SFPs or school feeding programs, CARE would love to be able to target pregnant and lactating mothers, but some donors want programs to only target primary school children, or even in programs with donors that do allow for community rations to target pregnant and lactating mothers, there may not be enough resources within the parameters of a budget to allow for the involvement of these women. Nevertheless, as CARE, we recognize the importance of the first 1,000 days and include it as a key component of our approach whenever we can make it happen. Another key component has to do with the fact that malnutrition and disease are synergistic. This means that the sicker you are, the more malnourished you become as your body diverts nutrients to fighting off infections and illness rather than ensuring they aid growth or physical development or optimal physical functioning. And the more malnourished you are, the weaker your immune system is at fighting off illnesses, and the faster a child or adult can fall into a vicious downward spiral. Ensuring that we address health issues when we talk about improving nutrition is therefore an important aspect of our programs. CARE's SFP programs aim to prevent wasting and stunting by providing a school meal or snacks that contain at least 1/3 of a child's recommended daily allowance, or RDA, of energy, protein, fat, in addition to key micronutrients such as iron, zinc, folate, niacin, and really all the B vitamins and vitamin A. Children need a diverse diet at school and at home to be able to thrive while they're at school. And so dietary diversity is definitely a key component of CARE's SBC messaging. CARE also has data from its programs that demonstrates the importance of nutrition in improved educational outcomes. Specifically, data from several countries has demonstrated that rural primary school students who ate breakfast before going to school or had a meal before sitting in class were found to have a statistically significant higher working memory score than children who did not. Now, working memory, for those of you who may not know, basically correlates directly to improved literacy and reading outcomes. And this data has helped to make the importance of school feeding known and understood, not only by governments in host countries where we work, but also donors as well. In terms of what school feeding looks like, generally a meal or snacks are provided at school and ideally are hygienically served before lessons start or sometimes soon after school starts. We need to ensure the ration is culturally appropriate and that it consists of donated commodities, if that's appropriate, as well as locally or regionally procured commodities. Dealing with commodities calls for a robust community management and logistics system. It's its own science. There are many considerations when we're talking about community management and logistics, including the safe transportation of commodities from their point of origin, whether that be a port or a field to schools, storage conditions. We need to take into consideration also environmental conditions when we're thinking about storage, for example, humidity. High humidity is a perfect breeding ground, for example, for aflatoxins, something that definitely compromises the quality of food. We also want to think about pre-cooked and cooked size of rations, believe it or not. That needs to be taken into account when thinking about not only storage, but also in terms of the safe and hygienic preparation of food by cooks. The seasonality of selected commodities needs to be taken into consideration, as well as who the targeted recipients are. If we're doing a community ration for pregnant and lactating women, we need to think about what that ration consists of, how big it is, and how that compares to the ration we'll be providing students in schools. Obviously, to ensure children reach their full potential, CARE strives to sustainably improve reading and literacy outcomes for all learners and uses evidence-based approaches and best practices to do so. We make sure these best practices are tailored and contextually relevant to the local system that we're working in, and that they're part of a holistic approach to ensure that disadvantaged children are positioned to succeed in school, physically, nutritionally, and cognitively. Now, local and regional purchase, or LRP, as it's referred to, is also a key component of our school feeding program. LRP helps to improve dietary diversity by incorporating fresh vegetables, animal source foods, and protein-rich foods into meals or snacks that are provided at schools. It also facilitates a transition from any donated commodities to local foods by stimulating local agricultural markets. CARE's LRP strategy is always grounded in a strong understanding of the local market system and in the active engagement of local stakeholders. That's really also very important, especially the government of the host country where we're working. And that engagement happens throughout the entire LRP process in order that governments and local communities are able to assume management for it at the end of a project. LRP also requires that CARE and then the eventual government and community members that inherit the program to ensure that robust quality assurance measures are in place, including food testing. And this is really important to guarantee food safety from the point that seeds are planted into the ground until that food is consumed and digested by a child. Now, I've already talked a bit about why nutrition health and maternal child health and nutrition are important. But I do want to mention that in these programs, CARE uses nutrition sensitive activities as well, such as hygiene nudging towards appropriate hand washing, The use of school gardens, as you can see here in this picture of a keyhole garden, micronutrient supplementation, deworming, etc. All of that is really important. In addition, CARE provides education or training on these sectors, on nutrition, health, WASH, and climate smart agriculture. And integral to that education or sensitization are specific social and behavior change activities. And this could be done through cooking demonstrations, through peer-to-peer counseling, and even in some cases through mass media campaigns. Now, there are a number of cross-cutting topics of our SFP approach. Gender sensitive and inclusive approaches to ensure equal access to food and health and education and nutrition services for girls and boys is really important. Now, as you know, gender equality and women's empowerment is at the heart of CARE's programming worldwide. And with education and school feeding programs, it is no different. And in fact, is at the center of what we do to make sure that girls have the same access to quality education along with health and nutrition services as do boys. In many countries, for example, it's important to work on shifting gender norms so that girls are not kept at home from school to help with domestic chores or taking care of other children. Another critically important cross-cutting topic is the impact of climate change. We all know that changes in weather are having an increasingly large impact on water availability and that it's impeding the production of sufficient amounts of food in many places more and more. Therefore, using climate smart agricultural techniques and teaching families and communities how to have food year round is essential and a key component of CARE's work. Using CARE's community scorecard is also a key cross-cutting tool used in our SFP programs to empower communities to hold school or health or WASH or really any other duty bearers accountable for the services that they provide and to ensure that those services are of high quality. Now, in terms of sustainability, CARE's sustainability approach in SFP programs is to empower schools and their communities to graduate from assistance and to continue sponsored activities on their own without outside support. And so it is really important for us to set up systems from the beginning of a project that will sustain improvements in nutrition, agricultural, health, and gender at the beginning of the project, as I mentioned, and that we support them over the life of a project, troubleshooting and working out any of the kinks in that system before the end of a project to ensure we can sustain improvements beyond the life of a specific project. A significant component of sustainability for these types of programs involves having in-country SFP legislation and laws that mandate government support for school feeding, including specific line items and budgets. If legislation or laws do not exist, or if they do not function well, CARE helps to create them and also helps to ensure that they're fully functional. Of course, the use of locally or regionally procured food and food systems is also paramount to ensuring school feeding continues, and therefore overcoming challenges, obstacles to agricultural production is necessary. Capacity is another issue as government extension workers and community members, especially volunteers like PTA or parent-teacher association members, for example, they need to have the capacity to take over the management and leadership of school feeding, in addition to having a sustained access to resources and as well as a sustained sense of motivation to continue their important work. In the end, CARE's school feeding programs are about ensuring that children have the ability to live up to their potential and therefore sustaining improvements in the nutrition, health, and gender is key to achieving an overall goal, or our overall goal of improving educational outcomes. Thank you very much for your time. I really appreciate the fact that you listened to this presentation. And if you have any questions, please do not hesitate to reach out to me. My email is here, gwenellen.o'donnell@care.org. And I'll be happy to, I look forward to working with you in the future. Thank you so much.